What a storm. We'll have to close early.
Too bad we can't leave, though. We finally managed to dodge the late shift, and we're stuck here anyway. Well, this bed has my name on it, so I'm gonna get some much-needed sleep.
Hey, isn't that investigator from Concordia supposed to stop by sometime today? I'm sure you'll be the first they'll want questioned.
Oh, don't worry, they won't be sending anyone out here in this weather.
I guess since no one else is around, all calls are being transferred to us. Dr. Blaylock speaking.
Is this the hospital? I need help. Someone's been badly injured.
Marcus, we have an emergency. Yes, this is Montgomery Memorial. Please remain calm. Now can you tell me what happened?
A man was accidentally shot in the chest with a rifle. He's bleeding profusely. I estimate that he's already lost about 500 milliliters. His CS is 233.
All right, we'll prepare for your arrival. How long before you can get here?
Mister, how long will it take us to get there? 10 minutes. Can you get us there in 5? We'll be there in 5 to 10 minutes.
Got it. We'll be ready. All the nurses have gone home. We'll have to do this on our own. Can you prep the OR?
The IV, BGA, and CT are all ready to go. So is the blood count and cross-matching test. Looks like the storm's headed our way.
I'm so glad you're still open. Here's the patient.
We're ready for him.
I've managed to temporarily stop the bleeding, but his vitals have dropped significantly. He's been shot in the chest. It looks like the bullet's still lodged inside him. His condition is critical. There isn't a moment to lose.
Everyone's already gone home, so you'll have to help me get him on a stretcher.
No problem. I'm actually a nurse. So if you're short-handed, I can help you with a procedure.
Now it all makes sense. I was wondering how you knew to report all that information. We can definitely use your help. Come on, let's go. Marcus, the patient's here. And this girl is a nurse. She's going to help us.
Finally, some good news. So does she have a name?
Oh, sorry, I didn't think to ask you.
I'm Elena Salazar, from the Concordia Medical Institute in Los Angeles.
I'm surprised Concordia sent someone as young as you.
It's nice to see you again, Dr. Vaughn.
Have we met before?
Let's save the introductions for later. We've got an operation to perform.
I know...
All right, let's begin.
Okay, we need to treat the external wounds. The round seems to have entered. Let's treat the gunshot wound before we open. I'll prepare the synthetic membrane. Please affix it to the wound. Now affix it with... The synthetic membrane fell off. Start the treatment over with the drain. The gunshot wound has been successfully treated. Now, let's treat the remaining wounds. All the external wounds have been treated. Let's open him up. He's in bad shape. Please keep an eye on his vitals while you treat his wounds. Doctor, you located the gun. We're dealing with his heart, so please be extremely careful when you extract the round. Let's drain the blood and determine the condition of the round. A mistake could be fatal. Please extract the round. What? This round is split into... The other half must still be lodged. We have no choice. We have to open the gunshot wound wider with this... We can't get a pulse with the round still lodged inside him. Please extract it quickly. Open up the gunshot wound with a scalpel and keep an eye on his vitals. A blood pool has formed. Please drain it quickly. You've located the remaining piece. Please extract. The round has been extracted. Please treat the remaining wounds. That completes the treatment of the wounds. Now please resuscitate the patient using the defibrillator. Now move the Wii remote for this gauge displays the amount of power. Press the Z and V. You're not getting a pulse. Your timing needs to be better. Please watch the gauge more carefully.
We have a pulse.
What a relief. Okay, let's close him up. Doctor, please close him up. Okay, let's finish by bandaging the sutured incision. That completes the operation. I was worried during that one part of the operation, but we made it. Great work, Doctor.
That was a difficult operation, but it went well with your help. You're a very skilled nurse.
Really?
Yes, really. I'd love for you to assist us again sometime, if possible.
But first, we should clarify some things. What instructions did Professor Wilkins give you prior to coming here, Elena?
You're right. I shouldn't hide my true intentions. But I didn't come here to spy on you. And I didn't come here to help you. I came here to ask you to operate on me, Dr. Vaughn.
What?
It's the pump unit you implanted in my pancreas 7 years ago. It isn't going to last much longer. Please, Dr. Vaughn. You have to help me.
Now I remember. So you're that little girl. Elena has intractable pancreatic necrosis, an extremely rare genetic immune system disorder. The disease surfaces due to stress caused by aging, viruses, or chemical substances. If left untreated, it could cause septicemia, cellular necrosis, and a severe case of pancreatitis. Thankfully, an effective immune suppressant was developed in 2015. So now the disorder can be treated by implanting a high-efficiency pump system in the patient.
But why do you need another operation? Is the system malfunctioning?
Yeah, it's designed to last for 20 years.
The antibody has denatured. The medication isn't working. To compensate, the pump's immunity suppressant control chips need to be replaced.
And you expected that someone at a remote hospital like this could do it?
I wanted to ask Dr. Vaughn to perform the operation, since he already saved me once before. I'm sorry I didn't contact you beforehand.
Oh, no need to apologize. You're quite welcome here.
Placing the pump unit is no easy task, and tampering with the implanted unit might cause stress and trigger an acute reaction. An inexperienced doctor wouldn't even attempt such an operation.
Doctor, we've received a shipment from Concordia. According to the label, it requires refrigeration.
I had them send all the materials necessary to perform the operation.
Marcy, please refrigerate them at once. The patient appears to be in good condition, but that doesn't mean we have time to spare. Once the preliminary test results are in, we'll need to operate immediately.
So it's a difficult operation, huh?
Yeah, it'll require some preparation.
Oh, are you heading back home, Dr. Blaylock?
Oh, hi, Elena. Yes, I am. You're staying here tonight, I assume.
Yes. I was hoping to catch a glimpse of the Northern Lights.
I see. Well, try to stay warm. By the way, I wanted to ask you about how you became a nurse. It must have been tough. Not only were you young, but you also had your illness to contend with.
Well, I was working towards something I really wanted, so I was able to overcome those obstacles. And in the process, I was able to learn more about my condition.
But you even received your international nursing license, right? That's amazing.
I was grateful to be alive. People are capable of so much when they don't take life for granted.
You're really mature for your age. I think you have a great career ahead of you.
Thanks. I can't wait to get back to treating patients, as opposed to being one. Look! The Northern Lights! It's so beautiful.
Yes, it is, isn't it? Elena, let's both do our best during tomorrow's operation.
Remain centered. Breathe. Focus. As the stars have taught me, I am one with life. I am one with now. Remain centered. Breathe. Focus. Should have unplugged the phone. Yeah, who is it?
Greetings. I'm sorry to disturb you so late, Marcus.
Professor Wilkins.
I suspected this would be a good time to reach you.
It would have been nice if I could have finished meditating.
I see you're still dabbling in witchcraft. Well, that's good, because it is precisely that sorcery of yours we must rely on now.
Look, I'll perform the surgery on Elena. Just don't expect me to return to Concordia.
It seems there's been a misunderstanding. She's not the reason I contacted you, Marcus. There's another patient I'm concerned about.
What are you trying to say?
Stigma has awakened, and I require your assistance.
What? Didn't I tell you that it was too dangerous to tamper with?
So you don't think you share in any of the responsibility, Well, don't be ridiculous. It's too late to wash your hands of this. However, there's no reason to let your feelings of guilt torment you. In fact, I have some good news for you. The patient I'm referring to is me. Well then, we shall continue this conversation another time.
Professor Wilkins has stigma. I can't believe it.
You look distracted today. Are you alright?
Yeah, I'm fine, thanks.
If you say so. Just as long as you'll be able to use your healing touch.
Well, if all goes as planned, I won't need to. Don't worry, Elena. Everything will be fine.
Oh, I'm not worried.
Now, about these microchips we're replacing.
Well, they went to the trouble of including instructions from the designer himself, so I'll indicate when you should bring them out. Fortunately, his directions are perfectly clear. I'll have to thank Professor Kerensky.
The operation is sure to be a success with such a well-prepared team. All right, Elena. I'm gonna begin administering the anesthesia.
Okay. I'll try to get some sleep.
All right, let's...
We will now begin Ms. The implant is in the pancreas. Please perform a laparotomy. This must be the implant. Let's use antibiotic gel to stop the hemorrhaging.
The wounds have been treated, but it's only a matter of we're going to have to replace the implants. First, we'll have to disable the current chips.
Use the laser to disable the control chip has been disabled. Use a scalpel to cut it out. Be careful of any hemorrhage. The control chip has been disconnected. Please now insert the new control chip into where the old. The exchange is complete. We'll repeat this procedure with the rest of the control chips. The third chip has been exchanged. Just one more to go. This is the last one. Huh? There's no... Use the drain to clear away the blood before continuing with the chip exchange.
Unbelievable! Another blood freeze.
Something's not right. Why won't the hemorrhaging stop?
I had a bad feeling something would go wrong. I guess I have no choice. Remain centered. Breathe. Focus. As the stars have taught me. Now. Okay, I've got some time until it hemorrhages again. I need to continue the operation while I can. The implant adjustments are complete. Patient's vitals. Let's treat the remaining wounds here. We're done here.
The healing touch. Amazing.
Sorry. but I'll have to leave the rest to you. I think I overdid it.
Marcus? Hey! Nurse Bloom, get Marcus out of here. I'll handle the rest of the operation. Ah, you're awake. You seem completely drained, Marcus. Is it because you haven't used your gift recently?
Yeah, I'm exhausted. How's our patient?
I completed the rest of the operation. Her condition's stable now. I'll keep an eye on her, so feel free to get some rest.
That sounds good. But I'll probably end up freezing to death.
I don't understand it. Why would they send someone with your ability to a place like this?
All right, enough with the sarcasm.
No, I'm serious. In fact, I'm a bit envious. Personality aside, I'd love to be you, Marcus. To have your ability?
Don't sell yourself short, Val.
What do you mean?
You didn't come here for the tropical weather. You came to refine your techniques, to learn the healing touch. But if you've already given up on that, then there's no reason to stay here.
Who are you to be judging me? You sulk around here all day like a mistreated dog licking your wounds.
Sorry, Val, that didn't come out right. I'm not very good at giving pep talks. All I can think to say is, try harder. Which isn't very helpful, huh?
I'm sorry, too. I shouldn't have snapped at you like that.
I guess when it comes to interpersonal communication, I'm no Dr. Montgomery, huh? Well, maybe if you pray hard enough, he'll visit you in your dreams and teach you the right way.